This is Victoria Smart, and today I will be transferring a patient from a bed to a wheelchair using a transfer belt. First things first, you guys have to meet my patient. This is Ted. He's the best. I get all the best patients. So I'm going to verify the provider's orders and gather my necessary equipment or supplies I will be needing. Today I'm going to need my non-slip, non-skid socks for Mr. Ted, as well as obviously my transfer belt. I am then going to enter the room and provide Ted a little bit of safety. Hi Ted, how are we doing today? I'm going to introduce myself to Ted as well as his family if they are present. I'm going to ask Ted, hey Ted, can you give me your name and date of birth please? And check his wristband by identifying him using two identifiers. And then I'm going to explain to him, Ted, today we're going to be transferring you, getting you out of the bed and putting you in the wheelchair. Is that okay? Making sure that I gain consent. I'm going to perform my hand hygiene and don gloves if indicated or need be. And then I'm going to lock the bed brakes, making sure that the bed is not going anywhere. I'm going to make sure the bed is at a proper workable height for myself. And then I'm going to lower the side rail that I am standing on that I'm going to be transferring him from. I'm going to then bring the wheelchair over to the side and put it at about a 15 to 45 degree angle next to the bed on the side that he will be transferring and sitting on. I'm going to make sure that the wheelchair is locked and that the foot rails or the foot rests are raised up so he has an easy pathway, easy access to comfortably get into the chair. Next, we're going to have him transfer into a sitting position. So I'm going to unblanket him, and I'm going to have him flip towards me onto his side, making sure that I am standing with a wide, stable stance up against opposite of his hips. I'm also going to make sure that my footing is diagonal, a little staggered, but diagonal from the head opposing top corner of the bed. I'm going to stand on the opposite side of his hips. I'm going to put this hand that's closest to his upper extremities underneath his shoulders, making sure that I'm supporting his head and neck. And then the other hand I'm going to place on his hip on top of his thigh, hip area. I'm going to turn diagonally and have Ted sit up and dangle his legs into a sitting position. I'm going to leave him there for a moment, let him relax, gain his balance, assess him and ask him if he's experienced any dizziness or lightheadedness. And then I am going to help him move to the edge of the mattress. So he's a little far back right now, so we're going to move him all the way up. I'm going to get right in front of Ted and have a stable, wide stance. Next, I'm going to place the transfer belt around his waist, making sure that the fit is secure and snug, but not causing any pain and not too tight. Then I'm going to assess him again for lightheadedness or dizziness, and I'm going to apply his non-skid socks. So we have those there. I'm going to apply them, and then I'm going to put his strong, dominant, weight-bearing foot forward and ask him to put his weaker or injured or post-surgical leg to the back. And I am going to allow him to sit on the bed for a few minutes, asking him if he feels dizzy again, making sure he's ready to go, and then I'm going to grab the gait belt on both sides of him, and then I'm going to tell him in a 1, 2, 3 rocking motion, making sure that I'm rocking with him in the same direction, and that everything is aligned so I don't throw my back out. 1, 2, 3, and then we are going to get up. I'm going to assess him for dizziness again, make sure that he isn't experiencing any lightheadedness, and then I'm going to pivot and turn And if he does have an injured or unstable leg, I'm going to kind of splint that and brace it with my bent leg. And I'm going to turn him and ask him to feel for the wheelchair with the back of his legs, the seat. And then I'm going to gently lower and ease him into the wheelchair, making sure that he's in a comfortable position, that he's not kind of sitting all on one butt cheek or leaning to one side. Everything should be aligned and comfortable. Then I'm going to put him here. Then I would replace the footrest and put his feet on top, making sure, again, I'm going to ask him if he's experiencing any dizziness or lightheadedness. I'm going to, if he would like, place a blanket on top of his legs. And then I'm going to make sure that his personal belongings are within reach. The call light is within reach and that he knows how to use it in case of emergency or that he needs me to come running. I'm going to note his behavior and how much he was able to assist me, if he did experience any lightheadedness, his balance or weakness, if anything changed, or any unforeseen event, like say he couldn't make it to the wheelchair and I had to lower him down to the ground and get some help, something like that. I'm going to document and report all my findings, and then I will let him know when I'm going to return.